it's nice to meet you. Are you Christopher?
Yes, I am.
Yeah, it's nice to meet you. And who did you bring with you?
Brandon.
Brandon, it's nice to meet you. Please make yourself comfortable. So we met a couple weeks ago. It's so nice to see you back, and thanks so much for coming today. I wanted to re-emphasize the nervous system, if that's okay. So, bringing out our lovely spine model here. Right here is back of your skull, and your brain sits right here. And going down through your spine is the spinal cord, and off of it come the nerves, the spinal nerves, which go out to the body, okay? And your brain sends all of its signals down through the spinal cord and out through the nerves to the body to communicate what needs to happen. So your brain is actually really cool in how it works with the body. It actually self-regulates and self-heals using those signals. So those signals don't go out to the body. That's what we call interference. And this interference, as it builds up, causes a subluxation complex. Okay? And as a chiropractor, we're going to reduce the interference or the subluxation complexes in your spine so that your brain and your spinal cord and your nerves can all communicate properly. You guys have any questions about that?
Sounds good.
No?
You told me last time.
Okay, so we want to make it communicate at its best. And there's actually some evidence. I know you came in with low back pain, and there's some evidence that really support that chiropractors help with low back pain. And here's some evidence for you. I'll give this to you in your packet that chiropractors are really good at helping with low back pain. And we've also had some patients come in with similar presentation as you, and they actually got a lot of relief. So I think you're in the right place. So what I think has happened, we did a full exam on you, as you remember. It took a long time, I know. But what I think is going on with our history and the exam that happened is you have something known as Facet syndrome. That's how the interference in your nervous system has played out and is showing itself. So what we're going to talk about is I'm going to show you what Facet syndrome is, okay?
Okay.
So we noticed that L3, 4, and 5, I circled the areas for you, are your problem areas here. And so here's 5, 4, and 3 right here.
Okay.
And Facet syndrome is where you see these little joints here between each vertebra. I'm opening one up right now. Those are called the facets, or the facet joint. Okay? Now I want you to notice one thing, or a couple things actually, when we jam these facets together. You see this hole right here on the side? It's known as the intervertebral foramen. These are both vertebra, and that's a hole, big hole that comes between them. And when I jam these facets together, what are some things you notice?
They hit really hard. It looks
They
like.
hit really hard. What else do you notice?
It looks like pressure.
Yeah. So one thing I want you to notice is that hole, it gets smaller, and the nerve actually comes through that hole. So that could be a problem in the communication. There are some other things that attach to these bones that could actually compress together on top of that as well. And then there's a couple other things when we jam them together. Bone on bone, does that sound very comfortable? No. So when we constantly grate these together, it actually makes a big angry inflammatory response, and that can be the root of some of your pain. And then there's this structure up here up front, these big spongy structures. These are called disc, okay? And that's where a lot of your weight bearing is supposed to be. I noticed on your x-rays that your discs are actually decreased in size from normal of your other ones. And that's why your facets back here are trying to help. So they're building up more bone so they can help the disc actually support all of your weight. Okay? And discs are something that don't grow back very fast, unfortunately. But if we put your bones back where they need to be, that can help your facets, help your disc, and so on and so forth. Do you have any questions about Facet syndrome?
No, it sounds great.
No? Okay. So now that we've discussed what Facet syndrome is, let's move to these. So I've circled your problem areas here with a pencil. And here's your problem right here, L4, 5, and L5, 4, and 3. So, as you notice, here are the vertebra, and here are the nerves that come off of it. You came in with some significant leg pain and trouble with tasks, using your legs and bending over and stuff, and some sensation. You see how these nerves go down to your legs, and how that could be causing some of your pain?
Yeah, I think so.
Yeah. And on top of that, we could also have your nerves that also go to your organs. So there can also be some other complaints that you could be having, such as some digestive issues. And you said you're having trouble with intimacy, so that could also, because it goes to the sex organs as well. So there are some other things we might need to address later on as well.
Okay.
Some other things you may experience positive benefits with. So actually going to use a hands-on technique, maybe instrument assisted in some case scenarios, but it's a very safe, gentle adjustment we're going to do where we're going to move these bones back where they need to be so they can function at their best, okay? And we may also use some modalities to help you with some of your pain at first, such as like TENS unit, hot, cold pack, stuff like that.
Okay.
And I think that will get you to where you need to be. I'm going to give this to you on your way out, but this is actually a really cool packet here, and it actually, in the back here, has your treatment plan on it. So you can go home and you can review it. And then there's also some really cool things, like some stretches you can do, and some of the symptoms you could be experiencing, and also some diet and exercise changes you can also do in addition to our care. So that's something you're interested in. You can read it on your own time. And I want you just to know that relieving your pain is one of our first priorities, okay? That's one thing we really want to address because pain makes it hard to function. But there's also some other things that we may also see, such as you had decreased sensation in your leg. So with therapy here, you might notice increased sensation. Or you said you had trouble with your ADLs. You might, ADLs are your daily living tasks, such as like laundry or picking up the kids and stuff like that. You may notice some of that's easier for you. And stuff like that in nature. So that's going to be like secondary things that may also come along, like good benefits, if you will, of additional side effects. So good side effects. I know that doesn't happen very often. I want to be really transparent with you and let you know that our flat fee is $50 per adjustment,
Okay.
and all the modalities are on top of that. We don't accept insurance in this office, mainly because you probably haven't met your insurance person, and they don't have a personal relationship with you, and we don't want them to tell you what kind of care is right for you. And we don't want them driving how we give you care. And we've seen that happen before, and we don't believe that's how care should be. So if you'd like to take your insurance and put it towards your care here, we're going to give you all the paperwork you can. It's called a super bill, and our people in the back can help you file that if you need some help. But you can send your insurance a bill, and they can reimburse you for some of it. Okay?
Excellent.
So I want to let you know that your spine doesn't align overnight. Have you ever been to the dentist and gotten braces and your teeth don't get straight overnight, right?
Yeah.
So when we're adjusting your spine, it may take time to put it back to where it needs to be. So that's something I want you to be cognizant of because it's a big time investment. If I want to say I want to see you 3 times a week for 3 weeks, that's going to be our initial starting plan. It's in your treatment plan here. That's to get you out of pain, but if we really want to address the core issues that are here, it may take longer than that. So I want to ask you guys, how committed are you to really addressing these problems?
I really want to get out of pain, so.
Okay, well, pain's going to be the first thing we're going to take care of. I think you'll notice that pain's one of the last things to show up, and it could be the first thing to go away. So we want to make sure that we really get to the core issues, and I hope we can move you towards pain-free care at first, and then a wellness care to maintain your issues that we've taken care of.
Okay.
So with that being said, are you ready to get started?
Yep.
Yeah.
Let's go.
All right, let's go get started.